years old mechanic is hit by the fork by the lip tract. He sustained Gastillo-Anderson type 3 of the fracture of the shaft of the left femur. So this is diagnosed case that it is the Gastillo-Anderson type 3A type of fracture. What is the most appropriate course of the action? That means it is not the definitive action, it is the course of action. That means what is the next step we should go for. So all time we have to see, is it definitive option or it is course of action or next action. Now the answering option, the options are amputation, debridement and external fixation, open reduction and fixation, debridement and placement of IM nail or intramedullary nail, debridement and placement of long leg plaster cast. So what may be the answer? So first of all, let's see the different type of the Gastillo-Anderson classification. In this three picture here we can see there is a minimal injury, and in there is another injury, and in the third picture here is the large injury. On the other hand, in case of Gastillo-Anderson type 1 type 1 classification and 2 classification and grade 1, 2 and 3 classification are given here. So in case of, first of all, in case of grade 1, that means the Gastillo-Anderson type 1, in case of Gastillo-Anderson type 1 there is wound size is less than 1 centimeter, and in grade 2 the wound size is more than 1 centimeter, and in case of the 3, which is the most dangerous, is the high energy wound and it is more than 10 centimeter. So 10 centimeter is a big area. So Gastillo-Anderson type 1 and type 2, they are usually a smaller size. That means the Gastillo-Anderson type 1, it is less than 1 centimeter, 2 more than 1 centimeter, and 3 when it is more than 10 centimeter and there is a high energy wound present. But this Gastillo-Anderson type 3, it is also divided into the 3 parts, and here we can see, first of all, in case of 3A there is adequate soft tissue coverage present, and in case of 3B inadequate soft tissue coverage present, and in case of type C, which is the most dangerous among the 3, which is the associated arterial injury, that means the neurovascular injury, actually the arterial injury. So the type 3C, Gastillo-Anderson type 3C is the most dangerous condition, and Gastillo-Anderson type A, it is the less complication in case of the 3. So what may be the answer, as it is the Gastillo-Anderson type 3A fracture? So what may be our option? We should go for debridement and external fixation because it is an open wound. So in case of open wound, for definitive surgery, first of all we have to give the immediate management, and then after 2, 4 or 6 weeks we want to go for definitive surgery. So the open reduction and fixation, usually it is definitive procedure. Debridement and placement of IM nail, it is also definitive. Debridement and placement of the long leg plaster cast, usually it is not required. That means the plaster is not required. The external fixation is the best option. And amputation is not required because there is no compartment syndrome, and there is no compartment syndrome which exists more than, or there is no crash injury which persists more than 6 hours. So here we can see, as there is no associated vascular injury, the patient may suitable for debridement and placement of the external fixation.